Hi, good afternoon, everybody, and thank you for joining our first community of practice call for the government section of Get Well Network for 2023. Today, we've got a pretty full agenda. So before I get into the agenda, let's meet our speakers for today. So our first presentation is going to be from the Sioux Falls VA Medical Center, and it's going to be John Mills co-presenting with Katie Layfield. John Mills is a clinical nurse leader, and Katie Layfield is our senior client success manager who has oversight of the Sioux Falls VA Medical Center. So they're going to talk to us today about how their facility used Get Well technology to meet safety requirements to reduce rates of healthcare-acquired infections. And then once they are complete, like Corey had said, you'll have the opportunity to ask questions. We do ask that you use the questions field within the GoToWebinar platform. And then as the questions roll in, we'll provide, about 5 minutes after their presentation where we'll have the opportunity to answer those questions. And then once they're complete, then Paul and I, Paul, my senior vice president for government, and then myself, the vice president for client success over our government division, are going to have the privilege to provide you with a 2022 year in review on how Get Well performed against your facility initiatives throughout 2022 and how we were able to show value on investment and return on investment in our product. And then Paul's going to go into a little bit about what is up for 2023 once we receive FedRAMP and what our solutions are going to look like moving forward as we get deeper into 2023. So without further ado, I'm going to go ahead and hand it over to Katie to go ahead and kick us off. So thank you, Katie and John, for joining today.
All right, great. Next slide, please. So first, I want to go through a quick agenda. Today, we're going to talk a little bit about the Sioux Falls VA healthcare system and then two focus areas that we have worked on over the last year. The first one is safety education on the use of the call light, and the second is reducing hospital-acquired C. difficile infection rates. Next slide, please. So John, can you first tell us a little bit about the Sioux Falls VA healthcare system? Which VISN do you fall within, where it's located, and what area of the region do you serve?
Yeah, we live in the Sioux Falls area. We are VISN 23, which includes North Dakota, South Dakota, Minneapolis, and Iowa. Our center pretty much provides services for people in South Dakota, Minnesota, and Iowa, and some from Nebraska, but that's our main group of veterans we provide healthcare to.
Thanks. And how long has Sioux Falls VA been a client with Get Well, and what units do you currently have Get Well installed?
We've been partners with Get Well since 2012. We have, excuse me, what was that question?
So which units do you have currently Get Well installed in?
We have Get Well installed in medical surgical units, 2 and 3 South, ICU, CLC, and 2 units in dialysis.
Okay, thank you. And then how long have you been working as the program manager supporting Get Well?
Since 1919, I started with the Get Well.
Okay, great. Next slide, please. So we're first going to look at our first focus area, call light safety education. Next slide, please. John, can you tell us a little bit about what was going on that led you to trying to find a solution with Get Well?
We had no basic standardization to approach the consistent documentation that patients were getting call light education. This was discovered in a root cause analysis, trying to look at the underlying reason for patient falls. So our current, so we had reminder instructions of the frontline staff just verbally telling the patients how to use their call light, but that had no standard documentation that this was being done consistently.
Okay, did you have any solutions in place with Get Well that touched on fall prevention or call light education currently?
Yeah, we had fall light prevention videos that were part of the onboarding package when a patient's admitted to an area there's 3 videos that they play to orientate them to the ward, and some infection control and safety things are talked about in those videos.
Okay, and without a specific solution in place, can you describe why this was a risk?
There was really no way to see who has been educated and when. The documentation wasn't consistently being done by the frontline staff admitting patients. And without specific educations, veterans could be confused on which button to push to ask for help. And the root cause analysis team attributed falls in part due to a lack of education and understanding by our patient population.
Okay, thanks. So what are some of the challenges that you faced prior to the solution with getting the education to the veterans?
It was the timing of admission and staffing. When a patient comes into a ward, they have quite a number of questions and different things they have to accomplish in a short amount of time. And that call light instruction kind of falls down the tier of things to do. Also, staff are more, like I said, staff are more worried about finishing their medical assessments and getting the patient set up for their treatments. Then we found a lot of times there was really no consistent education on how to use their call light system.
Okay, thank you. Next slide, please. So you can go into the next slide. So really, in order to implement a get well solution, we have found that we need these 3 things in place to succeed: the right people, process, and technology. So we had to work with key people within the VA, including John, our program manager. We also worked with the nurse managers and then the quality and safety department. And then on the get well side, it was myself working with our content configuration team and our interface analyst. So the process we had to do was really decide on how we wanted to get this education to the veterans. We had to decide on where we wanted it. We decided we wanted it on all units. We wanted all the veterans to be educated on use of the call light. And then when. We did decide that we wanted it right upon admission, and then how we were going to do it. We decided on the essential or mandatory education because that occurs right away when they're admitted. And then we also had to decide on how we really wanted this to look. So John was able to come up with the verbiage or the wording of the documentation and provide me with a PDF that we could upload into our system. So that was the technology in place. So with that mandatory or essential education that each veteran watches on their Get Well screen when they're admitted, we were able to perform one single redirect at the end of the videos that brought them to this PDF. And they were able to view or acknowledge this information with a select button, and that would trigger documentation back into the EMR. So we'll look at that on the next slide. So John, can you review how you made these decisions and what steps were taken prior to go live?
I first, worked with Katie on finding out what's the capabilities of Get Well and how best to use those capabilities to get the information to our patient. We have a couple work groups, the patient Get Well caregiver support group that's basically comprised of frontline staff, and we discussed different methodologies to get that education to our patients. And also we went through the Get Well executive leadership team to get approval to go ahead and implement this.
Okay, next slide, please. So this is what the documentation looks like back into CPRS. John, can you discuss how this captures the safety requirements that you were looking for?
That note on the slide is basically what appears in our electronic medical record in CPRS, and that documents the patient was educated on the time and date and what the safety education on use of call light, what the subject was. So that was an automated process. So once they saw the tile and hit the button as acknowledging it, that note was automatically generated. So there was no really third step in that to achieve the documentation.
Okay, next slide, please. And then can you tell us about how the launch went and any updates that you have made since go live?
We first did a test patient and looked at how the system presented the slide. And you can see that the slide was kind of cumbersome. You had to scroll down to the bottom to hit continue. And the information wasn't quite where we wanted it to be. So we adjusted that so it took the whole screen up in one slide and there was no having to scroll down to hit the continue button. So we kind of changed the way the slide looked to be more visually prominent to the patient on how to use their call light.
Okay, next slide, please. And can you see any changes in your fall rate since the launch of this feature in FY22 quarter 2? And how are you measuring success with this?
Our fall rate did drop. Falls are quite a complex thing that can contribute to many different factors in a patient's care. We also, that was kind of about so we did see some decrease, but overall there was not too drastic of a change. The main safety requirement was we had very low compliance with call light education, that once we implemented this, we were almost 100% all patients had education and documentation of how to use their call light.
Okay, thank you. Next slide, please. So our next focus area that we'll discuss is on reducing hospital-acquired C. difficile infection rates. Next slide, please. And John, can you give us a little history about how this focus area recently came about?
C. diff infections that are contributed to hospital acquire. We need to screen all our patients for loose stools within 72 hours of admission to the hospital. Otherwise, if it's discovered after that time window, it becomes a hospital-acquired infection that accounts against our cell data that measures our performance. So we.
Okay, what challenges were you having with the current way that you were trying to get the information from the veterans?
Most timing of admission. Multiple questions are asked from the admission process, kind of overwhelms the veteran and frontline staff. The admission can be quite time consuming for the staff. So often, even though the patient was asked verbally about loose stools, it still wasn't being documented or brought up to infection control's attention to do further screening.
Okay, next slide, please. So once again, we had to go through our people, process, and technology. So on the VA side, again, I worked with John, and then specifically quality and safety on this. And then also, again, our content configuration specialist and interface analyst within GetWell. So we had to decide on how we were going to capture this information. We decided upon a survey on their GetWell screen, and we had to decide on where we were going to launch this, when we were going to launch the survey, the specific verbiage in the survey, and then who's going to receive notifications and when it's going to receive notifications. So that's the technology. So we're able to prompt a survey on their television screen. We can set the question, and then we can also set at which responses do we want to push out an email notification to key staff. Next slide, please. So John, can you tell us about when this recently went live and how the survey is configured?
The original question we asked if they had any recent loose stools. We found that once we interviewed staff and everyone that we were missing the target, so we had to change that with input from infection control and DR coordinator that we needed to ask if it had happened within the last 48 hours. So we changed that verbiage.
Okay, and this just recently launched. So on January 9th of this year, the survey prompts 1 hour after admission. And then if they don't respond, it's going to trigger that prompt every hour until they actually respond. So we are sure basically we get an answer from everyone. We did set it to default at no, so if they're just clicking on their screen, we're not going to get those false notifications. But if they arrow over and answer yes, it is going to push out email notifications to the staff. And then, John, can you explain who the notifications go to?
Yeah, they go to the infection control MDRO coordinator. They're here Monday through Friday. To get 24/7 coverage, we had nursing officer of the day also added to that mail group that will be sent out.
Okay, next slide, please. So this went recently live, and John, you kind of discussed a little bit about how the verbiage was changed. You can also see on this screenshot that we actually pushed out our new user experience recently to the Sioux Falls VA as well. So now it prompts on the right side of the screen. So can you talk again a little bit about how you changed the verbiage of this and what feedback you had gotten from staff to trigger that?
I guess there was some confusion. It was pretty general question if you had recent loose stools, so we needed to narrow that down to a more specific time frame to get more accurate responses from patients. And this was from the feedback that we got once the MDRO and the infection control nurses followed up with the positives that seemed to be kind of an underlying cause of confusion with our patient population.
Thank you. Next slide, please. So as you can see on the chart along the top, that there was a steady increase in the C. diff infection rate in FY22 that prompted Sioux Falls to look for a solution within Get Well to assist with this. So we'll continue to monitor as new data comes out, but right now we only have sale data through FY22, so it's really too soon to tell if there's going to be an effect. But we are able to pull the survey responses on the bottom. So you can see the responses since we've launched this. About 13% are reporting that they have had recent loose stools or within the last 48 hours. So that does push out those email notifications for those. John, can you tell us about how you measure success with the launch of this survey in Get Well?
We just look at responses and trying to find out how many positives we got with the C. diff screen and how many were actually positive screens. It's like we said, we just rolled this out a few weeks ago, so we haven't really had a lot of time to see how well it's done over a significant period of time to see the trend.
And what sort of effect does automating this survey have on the VA and staff there?
The kind of golden rule when we implement stuff is it a time saver for the frontline staff? We found that adding just one more task, some that takes a few minutes, tends to be the last straw to break the camel's back. So with the current heavy load that our frontline staff have, we've been trying to utilize Get Well the best we can to minimize their workload and to help automate certain processes by Get Well so they can take one thing off things they have to do and help improve patient safety at the same time.
Yeah, absolutely. And your team in Sioux Falls is really creative in how you use Get Well. Can you tell us why it's important to think outside of the box to find the solutions?
Yeah, we have, like I said, we have that patient design, frontline staff Get Well team meeting. So that's just basically open to all frontline staff. Every once a month, we have an hour where anyone can call in and just talk about things that they would like to address. And we kind of do some brainstorming and come up with some possible ideals. And also I use Katie as the subject matter expert on Get Well on what we can do with what we want to achieve with our input that we just got from frontline staff. Then once we have an ideal on what we want to do, then we always bring that forward to our leadership in the hospital to make sure they're okay with us rolling that out. And also just to keep them in the loop for communication so they know what our current efforts are and that they're aligned with what the hospital's priorities are for infection control and patient safety.
Okay, thank you, John. So that's all we had. So I will turn it back to Karl or look to see if we have any questions.
Sure, thanks Katie and John. And it looks like we did have one question come in from a Mr. Thomas Blair. And I apologize if I messed your name up. The writing is really small, but let's see here. It said, regarding the C. diff process, what is the process after the survey screen is positive and gets to the right person? Does it come back to the manager, nursing staff, or the physician somehow?
Usually frontline staff will be notified if they had loose stool, and then they have to get a loose stool sample sent to lab to do a C. diff screen. Once that there's a positive and the patient's correctly answered the question, when that's confirmed, they usually put into contact isolation until C. diff is ruled out, also to prevent any further spread of the infection to anyone else.
Awesome, thank you. I don't see any other questions on the screen at this point, but there might be some that pop up through the next presentation. So if we do get any more, we'll just address them at the end if that's okay with you, John and Katie.
Yeah.
Thank you.
All right, thank you very much. Now let's move on to 2022 year in review, as I promised you all. This is where I will be co-presenting with Paul Huelskamp. So a brief introduction about myself. If you don't know who I am, my name is Karl Morneau, and I'm the Vice President over Client Success over our entire government client organization. And right now, before I get to how we've grown over the past couple of years, I wanted to kind of kick off the presentation with something that we call patient love within the Get Well community. And that's the ability for our solution to be able to collect patient sediment in real time from your veterans. And so because I live down here in Florida, I always love visiting aid. I get my care at the VA Medical Center here in Gainesville as a survey-connected veteran. I would not go anywhere else. I think the VA treats their veterans outstandingly, and the care that I get there is top-notch. And I know for sure with my complex issues that I have, that's the best place for me to be. And so I wanted to share some feedback with you all before we actually get into the meat of our presentation, because all the feedback we get from Get Well is incredible. The veterans love you all. They love the work that you're doing, taking care of them. And more importantly, you know, as a veteran, I want to thank you all for choosing to work at the VA. The VA takes it on the chin quite a bit. And, you know, I've seen it on the inside and the outside. And I just want to thank you. You all could work anywhere, and you choose to work for the VA to take care of us veterans. And so thank you for doing that. So let's talk about Get Well. So Get Well has been in the government community now for going on 13 years. We actually started off with 2 VA clients, the Erie VA Medical Center up north, and then the Birmingham VA Medical Center down in Alabama. I actually started my journey with Get Well shortly after the VISN 8 contract was awarded way back in 2013. And I actually started off my journey as a client success manager here at the Gainesville and Lake City VA Medical Center. And so I've truly had the privilege to work and see Get Well grow to where we're at today, to where we are over 70 VA medical centers now that have the Get Well inpatient solution. We're in 5 VISN-wide contracts, and we're in over 13,000 beds that are engaging veterans every day with interactive patient care. And so we're very privileged to be in the position that we're in right now, to be able to work side by side with you all, not only providing the enhanced entertainment options and features that we provide veterans, but also being able to provide patient education, provide care plans to help improve the experience of the veterans, as well as helping prepare them to better take care of themselves once they get discharged from the facilities. So the agenda that Paul and I are going to cover today is I'm going to kick us off, like I said, with a 2022 year in review. We're going to talk about value planning and outcomes reporting. That's the meat and potatoes of what we do as an organization for you all. We're going to talk about our partnership summary and highlights. And then at the end, we're going to talk about what's new on the product roadmap for 2023 and beyond with Get Well. So to kick us off, I'm going to show our Get Well portfolio of products. If you are not familiar, Get Well is a cross-continuum solution that offers patient engagement solutions throughout the continuum of care to our patients. On the VA side, with FedRAMP certification, that's just around the corner. We're probably a month or 2 away from that. We're truly going to become a cross-continuum solution to where we can offer our outpatient solutions to the veteran population. So we're really excited about that. But what we're going to be talking about today are going to be those two solutions that you see on the left-hand side of the screen. That's going to be the Get Well inpatient solution and Get Well Rounds Plus, which is our mobile rounding solution. As anything, when we work with our clients, you know, from the initiation of the contract through the life cycle of the contract, we established with what we call a value realization plan. And if you've been on any executive partnership review with me, you know that I talk about this in depth. And I want to talk about this with you all because this is really where you are going to see your maximum value on investment and return on investment with Get Well, is identifying specific focus areas for performance improvement that you want to leverage technology to tech enable your clinicians and your staff to help lessen the burden on them, to allow them, the nurses, to be able to focus on clinical care, you know, and not focus on those non-clinical tasks that bog down, you know, their day, where they're sitting on hold with another department, you know, within your facility to try to get the veteran a new meal tray, or maybe to get EMS to come and mop their room. You know, we really want to partner with you all to where we can leverage the automation that we provide to be able to automate those services for your facility, to get that time back to clinicians within your facility. And you're going to see in the next set of slides where we've really started to impact your facilities by taking those non-clinical tasks off of the hands of your clinicians. And so when we look at value drivers, we look at really improving, impacting performance improvement in three really key focus areas. One is around veteran satisfaction. The next one is around improving workflow efficiency. And the third one is around improving quality and safety. And the way that we measure success is that we monitor your sale and your SHEP progress, your scores, all those standardized scores, you know, reports that get published on a quarterly basis. We take a baseline worth of data, typically a year's worth of data, before we put a Get Well solution in place. We measure that over a period of, you know, a quarter to 6 months before we you know, have an initial baseline. And then we start to report out, you know, quarterly data and monthly reports after that to the facilities. But what we do is we ask you to identify at least one focus area in one of those three key areas. Once you identify that focus area, through your partnership with us and your client success manager and myself and my client success director, we're going to recommend the best solution that Get Well has to support that focus area. We're going to recommend, if you don't already have interfaces that allow us to talk with your electronic health record for automatic documentation and allow your clinicians to order from directly within the chart. We're going to suggest interfaces that you might need to put in place to support that particular solution. And then, like I mentioned, we're going to look at your sale and your SHEP data and start monitoring and measuring success. One thing that we added in 2022 to our value realization plan is that we wanted to have a champion identified at each of the facilities for us to work with. And so, for instance, if we're going to be looking at focusing on veteran satisfaction, who most important that we work with in your facility than your veteran experience office, or your chief of veteran experience? That would be the person we would love to partner with. We work with them around establishing what would be a target goal for success. So for the example you see on the screen here, we decided to go with a 5% increase in overall SHEP for that particular focus area. And then we report out, you know, quarterly what you are achieving towards that success. So you can see here an example of the 3% increase for quarter 2. So we're on track with that 5% overall increase. And so we ask for all the different focus areas that we have a champion identified, typically somebody who already has vested interest in that area. So if it's a patient safety focus area, let's get patient safety involved. If it's a quality and safety area, maybe we need to get quality and safety involved. You really need to look at Get Well as not reinventing the wheel, just as John and Katie had presented in their first presentation. We're not here to reinvent the wheel at all when it comes to performance improvement. We're just bringing in a technology aspect piece to allow to tech enable your clinicians and your staff, again, so they can focus on top of licensed care. Let our solution be the technology piece that gives time back to them. And so when you're looking at implementing a Get Well solution, we want to look at your current state. We want to see how you're currently tackling a specific focus area. And then from there, we're going to figure out how we can leverage our solution to improve upon that solution and not to replace it. That's a big thing that we kind of struggle with our client community out there, and especially communicating that to the end users who we want to use the software, is This isn't just another flavor of the week. This isn't just another ask that we're being asked to do. We want this to become ingrained in the culture. We want it to be looked at as a time-saving device that's going to give the clinicians back time, because we understand. We're hearing it from the CNOs across the country that there's a shortage in healthcare workers across the nation right now. Y'all are doing more with less, and there's no relief coming anytime soon. And so technology is where it's at. We really want to make sure that our technology is configured and leveraged to be able to meet the needs of the future. And so within your client community for 2022, these are some outcomes that I wanted to highlight. So I reviewed all of the facilities data from 2022 once we finally got the sale and the chef scores from Q4 of 2022. And I am proud to say, and this was actually surprising to me, that first bullet that you see at the top of the screen. We have 5 VISN level contracts in place right now, which means that those 5 VISNs, all of their facilities have Get Well in place in the inpatient side of the house. 92% of those facilities in those VISN level contracts exceeded the national average for overall rating and willingness to recommend, which is a huge testament because we all know how hard it is to move the needle in a particular focus area, let alone move the needle for an entire VISN. But we were very proud and very pleased, to be able to report that in 2022 that it happened. But let's look more importantly around those 3 focus areas again, around veteran satisfaction, quality and safety, and workflow efficiency. You can see we've had some double-digit improvements across the board, across the country, not just in one particular area. Like we had a 45% increase with satisfaction of staff responsiveness in one of our VISN 8 facilities. In North Carolina, we had a 28% increase in care transition, satisfaction or care transitions. Underneath SAIL improvement, we had a 31% decrease in hospital-acquired infections, but focused on CLABSI in a California veteran medical center. We had a 3% decrease in congestive heart failure readmission rates through our heart failure care plan in Albuquerque, New Mexico. And so across the country, we're seeing positive results from the use of Get Well, and this is true testament to our partnership. And we really, like I said before, we're really privileged to be able to partner with you to be able to make a difference, in your facilities and also in the veterans' lives that are in your care. So let's talk about return on investment and value on investment. This is something new again that we did this year with all of our clients. And so what I have done is I have put together kind of an overall nationwide average of how we've saved money and what those dollars look like. And also hours that were saved to clinicians through the automation of education. And so I'm going to talk a little bit about the formula we use for this. But again, I just wanted to point out what I've done here is I have a national slide, then I broke it down by VISNs. So I'll go through each of the individual VISNs so you can see how Get Well has impacted your particular VISN for 2022. And so looking here nationwide, you can see we had a tremendous amount of health education and video education completed and documented automatically back into the electronic health record. Health education is really our bread and butter when it comes to being able to prepare veterans for discharge, keep them safe while they're in the hospital. And when we look at providing automated education, all of our videos are 3 to 5 minutes in length. And so when you automate education, you're actually giving 5 minutes back to that clinician, because now all they have to do is order a video, ensure that the veteran actually watches the video and completes the video. That's like 30 seconds. The video itself is giving that clinician 5 minutes back so they can focus on other things. And so when you look at the national average of what it costs for an FTE for an RN across the country, which was $40 an hour, believe it or not, is the national average. It's different regionally based. We get that. But for national standpoint, I just wanted to keep national numbers here. We were able to give back roughly $40 an hour for every hour's worth of education that was given back. And so looking at 5 minutes time saved per video completed, and then the other feature that we have is called service requests, which allows the veterans to be able to order specific services from their television, whether it be requesting a chaplain, ordering an additional meal tray because they got the wrong meal tray delivered, ordering additional room cleaning. Those are just a few examples. But the time saved in that is 15 minutes. So if the veteran can actually request those services from their television, they don't have to get the clinician involved now. The clinician doesn't have to go back to the nurse's station, get on the phone with EMS, wait on hold for 15 minutes, get a hold of somebody for them to put in a work order. Our systems will automatically do that for you. So now the clinician, just needs to be made aware that our service request was put in, but our system takes over and even escalates if, the request that the veteran requested is not handled in a specific amount of time. We can actually escalate that up the chain for that particular department to notify the managers and also notify the chief of that service that they might have a gap in service recovery that needs to be handled. And so overall for 2022, we saved roughly about 40,000 total hours of clinician time, and also $1.5 million saved based on, nursing staffing and based on the hours saved by providing automated education. So let's start off with our first VISN. So VISN 2 is one of our smaller contracts. We have the VA New Jersey healthcare system, which consists of 2 campuses. You can see their key features in use, and you're going to see a pretty common theme. A lot of our VA medical centers have standard care across the board. Everybody pretty much uses our patient education platform and our medication teaching platform, as well as our patient experience perception platform, because that really gets that live patient sentiment in the hands of the folks that have the ability to do that service recovery and improve the veteran's experience while they're still in-house. And then we have our discharge and falls pathways that help educate the veteran around what they can do to become, to help reduce the risk of falls, and also to help reduce and get them prepared for discharge. And so looking at VISN 2, you can see $46,000 was roughly saved in 2022, and then about little over 1,000 hours of clinician hours saved through the use of the Get Well solution. In VISN 4, this is one of our newer contracts that we were just awarded in 2022. So we will bringing the rest of VISN 4 live with Get Well. They're actively implementing right now, but right now the only facility that we had live was the Lebanon VA Medical Center. And so the Lebanon VA Medical Center located in the central of Pennsylvania. Again, you can see key features are pretty similar to other VA facilities. They saved on average about $36,000 and about 900 hours of clinicians saved. And this is a smaller VA medical center. You're going to see our larger ones, obviously larger ones like the Washington, D.C. VA, which is in VISN 5. They had a larger dollar saved because obviously more beds, more engagement, and more education videos completed. We were able to save $61,000 there and about 1,500 hours of clinician hours saved and given back to clinicians to focus on top of licensed care. VISN 6 is again one of our newer VISNs that came on into the Get Well family. They consist of Richmond, Durham, Salem, Fayetteville, Salisbury, Asheville, and Hampton. They had a pretty impressive year last year where they overall saved about $315,000 in clinician hours, as well as a little under 8,000 clinician hours saved through the use of automated education and care plans. VISN 7 is another one of our active VISNs. Birmingham VA is one of our legacy clients, was our original client. It's been with us at the beginning, 13 years ago is when they signed their first contract with us. We have the Atlanta VA, which is an active implementation. That's a really large VA medical center with multiple campuses. And then we have the Columbia VA, which is active implementation as well. And so right now, with just the Charleston VA and the Birmingham VA, we saw about $105,000 saved and about 2,600 hours, clinician hours saved through the use of automated education. VISN 8. VISN 8's always had a special place in my heart. It's one of our largest, was our first VISN contract and one of our largest VISNs. You can see just by the total number of dollars saved, but we have 8 facilities that are currently live with Get Well: Lake City, Gainesville, which consists of the North Florida, South Georgia Veterans Health System, the Orlando VA, the Tampa VA, Bay Pines, West Palm Beach, Miami, and then we cross the ocean down there to go to San Juan, Puerto Rico, which also has Get Well, which is part of VISN 8. And so we were able to save $640,000 in clinician hours and 16,000 hours in clinician hours saved. A lot of these VISN 8 facilities also are contracted for our Rounds Plus solution. And so we wanted to highlight here that throughout 2022, there was 23,750 rounds completed on the Rounds Plus solution. Mostly these are the We Care leadership rounding, or they might have some Joint Commission audits that they might be using to complete. but mostly the Orlando VA has really, really cracked the nut on how to leverage, and they become a best practice facility for anybody interested in how to implement Rounds Plus within the culture of your facility. I highly recommend reaching out to Orlando. Orlando is a best practice, even on our commercial, amongst our commercial clients too as well. The utilization of Orlando and that Rounds Plus solution is just incredible. Business 17, which is in the Texas area, that's Dallas, Big Springs, Bonham, San Antonio, Kerrville, Temple, and Waco. $165,000 saved and 4,100 hours of clinician hours saved amongst all of their facilities. We have Vision 19, which is the Salt Lake City VA all by themselves out in the middle of Vision 19. We had $46,507 saved there and 1,163 clinician hours saved. Vision 21 is another one of our large Vision level contracts that is going to be going live here in the next 90 days with their third facility, but the first facility that went live was the Mather Martinez VA Medical Centers up in Northern California. So the numbers that you see reflected here are just from Mather and Martinez. The rest of the facilities, minus Palo Alto, are actually live with GetWell, are actively implementing, but we're expecting the rest of Vision 21 to be live by midsummer this year. And so right now, $50,000 saved for the Northern California VA medical system, and then you had 1,260 clinician hours saved through the use of automated education. Vision 22, which consists of Albuquerque, Phoenix, and Prescott, pretty impressive, $177,000 saved there with little under 5,000 hours of clinician hours saved here as well. And then finally, Vision 23 up north there in the cold, we have the Sioux Falls VA Medical Center who presented today. Pretty average sized VA Medical Center, but they were able to achieve a $22,000 savings as well as giving back to their clinicians 550 hours. And so if you have any other questions when it comes to, how we attribute VOI and ROI, you will have the opportunity to have these slides. We'll send them out after the presentation. But if you would like me to go into a little bit more depth around, the different service lines that might have been impacted, we're more than welcome to work with you. Just reach out to your client success manager, and then they can schedule some time with me to work through it a little bit more if you want a little bit more details around that. But it's definitely been a privilege and an honor to work side by side with you all throughout 22, and we look forward to 2023. So before I hand it over to Paul, I wanted to talk about the next big thing on the horizon. And most of our facilities right now are still in the queue, but we have gone live in a handful of facilities with our GetWell new user experience, which we are calling the Consumer UX. And so the Consumer UX, we partnered with a company called Work & Co., which are the industry experts in designing consumer-centric user experience for big companies like Apple and AT&T and Microsoft. And so why not partner with the experts in the industry? Because we identified, that our system was kind of old and clunky and that it needed an upgrade. And so we were lucky to have Todd Strickler come over to us from the Marriott Corporation, who was very involved in the architect behind the Marriott Bonvoy app. So if you ever travel and you use the Marriott Bonvoy app, Todd Strickler was the architect for that. And Todd Strickler, in his tenure with GetWell, it was the architect behind the new Consumer UX. And so we're very proud about this. The new Consumer UX is really focused on two areas for improvement. One is around self-service. Requires little to no training of your veterans. They will be able to hit the ground running with using the system because it is very user-friendly, less clicks to get to the things that are important to them, like the entertainment and the movies and the internet. But also to get to the healthcare, related items like the care plans and education is also easy to get to on the system as well. And so right now, Vision 8 went live last week with the Consumer UX. The Sioux Falls VA was live. They were one of our early adopters, and then the Lebanon VA was our earliest adopter of the Consumer UX. Nothing but positive comments from the client community so far, both commercial and on the veterans. The veterans absolutely love the new Consumer UX. I was reading some comments that a veteran, was a familiar face. We're not calling them frequent flyers anymore. We call them familiar faces now. was a familiar face at 11 on VA and was actually pleasantly surprised when they were readmitted into the facility. He was discharged from the facility with the old UX, and then when he came in with the new UX, he was like, "Oh, y'all got a brand new TV system. This is awesome." But no, not really. It was just Getwell had a facelift. He had all the same stuff that he had. It was just a different look and feel, and he absolutely loved it. Was able to find the things that were important to him rather quickly. And then the second thing is around giving time back to clinicians, like I've been talking about, during this whole presentation. Let's look at where we can trim some of that time away from the clinicians about those non-clinical things that we could direct, the veterans to their television to request, and let's give that time back to the clinicians. They got enough stuff to worry about than have to sit on hold, to get a hold of another department within your facility. Let Getwell handle that stuff for you all. All right, so from there, I'm going to go ahead and hand it over to Paul Huelskamp, who is going to talk a little bit about FedRAMP and the path forward with FedRAMP.
Thank you, Carl. And welcome again, everybody. Great to see you on the screens. I'll start here with our Getwell inpatient and Rounds Plus integration. Part of the benefit of FedRAMP will be our ability to feed the Rounds Plus solution from Getwell inpatient. For those of you who have Rounds Plus, it's a point of service data collection tool, but that Plus piece means we can do a whole lot more with it, including text-based, QR-based, and email surveys. So that'll be added functionality that'll be coming here very soon. And really what I think is probably the best integration that we'll have, think about surveys that you're doing, like you saw with Sioux Falls earlier in the conversation. That's a survey that's done on the inpatient side of our platform. But after FedRAMP, the two systems will talk to one another. So if you're a nurse and a patient has said they don't understand their education in response to a survey done on the inpatient platform, you're now rounding on a patient. You can get an alert on the round system that says, Paul didn't understand his education about his hip replacement. And you can then engage by exception with me to do that teach back instead of trying to figure out that every patient needs to have that teach back done. You can really limit your focus to those who are in most need at that time. So that'll be one of the benefits that comes from FedRAMP. If we can go to the next slide. This is the product wheel that Carl shared earlier. And I'm going to spend the rest of my time with you today talking about the Loop product over there on the right. What you will see through FedRAMP is we now have the ability to take all of our solutions and put them in the cloud, which gives us the enhanced security that the government is looking for from an all cloud deployment of platforms. But it also allows us to heavily integrate these solutions together to give you better connectivity with your patients. So on the next slide, I'll start off with a discussion of where we are with FedRAMP. We've talked about FedRAMP quite a bit with you guys over the years, or at least the last year you've seen us talking about it. The last 2 years has been really our journey towards FedRAMP. And the VA is estimating as of Friday of last week that we will have our authority to operate within FedRAMP by May 23rd of this year. So that's when everything cloud-based will be able to be launched to your facilities and your patients. Now, hot on the heels of that FedRAMP authority to operate will be an authority to connect with Cerner. I know a lot of you don't have Cerner yet, but anticipating that Cerner is coming down the road, we have requested that we have authority to connect to Cerner, and that consideration process is underway. For some of our clients out in the Pacific Northwest that already have it, that will be a key thing for them to get up and running quickly. But for the rest of you, we're working hard to connect with Cerner on an enterprise level. So those of you who are moving to Cerner will need to be in the cloud for us to connect to. We are Cerner's engagement partner in the commercial sector. So a few years back, Cerner discontinued all of the patient engagement tools that they offered through their platform, and they adopted Getwell as their standard. So we have deep integration with Cerner, and we're looking forward to bringing those capabilities to all of you. Now, with this authority to operate, Loop will be one of the solutions that we can allow you guys to use to continue to connect with your veterans when they've left your inpatient facility, or even if they've never been an inpatient. So the Northern California VA healthcare system is currently under contract with us to implement approximately 16 care loops. That implementation work is almost done, and we're just waiting for the authority to operate to launch those loops. Now, one of those 16 loops is something that we're referring to as the repatriation loop. And it's designed to bring veterans who are in the community care program seeking emergent and urgent care through those community care providers back to the VA. What we understand from our listening tour around the VA is that many veterans will go out to an ED or an urgent care close to their home, but that also leads them out of the VA into a care system that oftentimes is not able to treat them as well as you guys can, or get them as timely a care. If you think back to the RAND study that was released at the tail end of last year, what RAND identified is community care is oftentimes more expensive than the VA, and it doesn't provide care in any more timely a fashion than the VA does. So it's in everybody's interest, I believe, being a veteran, to come back to the VA for the care. So the way we operationalize Loop is through 250 care plans. And we're going to share those with you in just a minute. And I wanted to highlight for you that at the end of those care plans, we're going to ask you a poll question. We want your opinion on what care plans we should be developing as we continue to move this solution out into the VA. So if you move forward one slide, this is a summary of the care plans that we offer by service line on the left. And then over on the right is an example of the orthopedic care plans that we offer. Now, in the subsequent slides, there's going to be another 4 slides that we're going to click through that will show you the care plans that we have by service line. So if we can advance slowly through the next 4 slides, you will see those care plans. And when we come to the end of these 4 slides, you'll start to see a poll appear on your screen so you can give us some guidance on where you feel we should take our care plan development. So you can see things like emergency department transitions, orthopedic surgery is heavy here, general surgery, ENT, spine. And then we move on to OB services, not as big in the VA, of course, but women's services are a growing service line within the VA, as all you know. Cardiology's in here, bariatrics programs are there that might align nicely with your MOVE programs. And finally, we continue down the path of there's COVID things, urology, a touch of behavioral health. That's an area we think we'll probably need some guidance from you guys on. Plastic surgery, and then our other category. So if we move one more slide, you should start to see a poll appear on your screen. And for those of you who will need to jump out of the call, we will be emailing some follow-up, and that will include the poll question so you can vote if you can't do that today. But we'd like you to take a look at the question, give us your feedback, even if you have to write in something to let us know what care plans you feel we should be developing for your organizations and the veterans that you serve. And that is the end of my part of this session. Carl, do we have any questions for either of us?
Yes, we had one question, but I just wanted to, so when you log out of the GoToWebinar platform, that's when the poll questions will actually pop up on the screen as part of that closing landing page. And if you wouldn't mind just taking a few minutes and just jotting down your thoughts on there, that would be awesome. But we did have one question come through, and it was from Connie Malik. And her question is, I hope we will be able to use Rounds Plus for patient feedback around our classes. And so I'm not sure, Corey, are you on? Is there any way we can unmute Connie so she can elaborate a little bit on that? It's kind of vague.
While we,
Carl?
go ahead.
Hi, Con.
Hi, Carl. You know I would ask a question.
I know. It's fine. We love you.
So one of the things we've struggled with over the COVID years is trying to get feedback about how our patients perceive the classes. Most of them are virtual, and there's so many platforms that we haven't been able to use. We can send, like, for example, something through secure messaging, but if we could do a direct collection of information through Rounds Plus after they've attended a class, that would be so helpful.
Yes, Connie, we actually just submitted a proposal to another agency because of the FedRAMP abilities that we'll get. You can do QR codes. So you could just have a QR code appear at the end of the class and they can scan it and complete a survey. You could text them for feedback or even send an email. So you get the functionality that you can use there. And for those of you who are also doing patient survey programs, you know my background prior to Get Well, and I met many of you during that time. Rounds Plus is a great way to do those surveys. It's got a similar reporting platform that you might be accustomed to, and it gives you kind of real-time ability to change those survey questions. So a whole lot more functionality than survey platforms that I'm used to.
And is this going to result in a contract modification? In other words, additional cost or?
For those of you who have it right now, you won't see a steep increase in your fees. For new folks that come on post FedRAMP, we are, there's a bit of a jump up in price, but nowhere near what you might see in some of those other platforms. For those of you who are using it currently, though, I should clarify, both systems will need to be cloud-based before you can get that integration. So for those of you who are using the inpatient platform that's currently an on-premises deployment, we've got a transition plan that we'll be talking with you, each of you individually about on when we take you to cloud.
Thank you.
And it looks like no other questions. So thank you everybody for joining us today. We do understand everybody's time is precious, especially, you know, as we're still trying to figure out navigating post-COVID, you know, and everything else that's being thrown at us in the healthcare industry. So we do appreciate your time today. Thank you again to Mr. Mills and Katie from Sioux Falls for your presentation. And this presentation was recorded, so the recording and the presentation, if you are interested in it, just reach out to your client success manager and we can share it with you. And feel free to share it amongst the masses for those that weren't able to attend today.
Thank you, everyone.
Thank you, everyone.